Hello, Dr. Vikki Petersen here. I wanted to speak with you today about something that all women who are planning to have children, and men as well for that matter, should know about. And that is a recent study that came to us from the American Journal of Psychiatry. And what they looked at was they found that women who had high levels of what's called Antigliadin antibodies. And basically that simply means that the gluten protein, you do a blood test and you ask the person's immune system, do they like the gluten protein or don't they like the gluten protein? And if they make what's called antibodies against it, it means they think it's a toxin, your body does. And so you'll see high levels of these antibodies, they're called, which basically shows your immune system is having a negative reaction to this protein gluten. That can happen in celiacs. It can also happen with gluten sensitivity. So it's not a highly specific test that way, but it at least shows you for sure that your immune system doesn't like gluten. So they did what's called a retrospective study, which means you can follow people who had their blood drawn, 20, 30 years ago and follow them into the present. So you're in present time, but you're studying blood that was taken decades before. And what they found in a group of women who had high levels of this antigliadin antibody while pregnant, what they found in their children was double the risk, 2 times the risk of developing schizophrenia and other mental disorders. Now, it's no news at all that gluten affects the nervous system. Many studies say it probably affects the nervous system more than it affects the digestive tract. It's also not new news that gluten is affiliated with increased incidence of schizophrenia and other mental disorders. So we know that, but that's about the person eating it and having the incidence. This is an interesting twist, although certainly not unheard of, because when a woman is pregnant, that child is being bathed in the mom's, in this bath that the mom is creating, if you will. So what they found is that there is a trickle-down effect of what the mother's immune system is doing and how it's affecting the child. Now, of course, you have the genetic link of celiac disease, and a mother with celiac has a child who's 5 times more likely to get celiac than a child whose mother doesn't have celiac. So there is that genetic component too, but it's very interesting to find this dramatic increased incidence in these women. Now, of course, if they were gluten sensitive and they were maintaining their gluten-free diet, they wouldn't have had these high levels of circulating antibodies. So begs the question that even if the genetics was there, would we have seen this increased risk? So that's a different study, but point to make certain of and point to make with those who are planning on having children is to find out if they're gluten intolerant before they conceive, or at least as soon as possible afterwards, and if they're gluten intolerant, to really maintain that strict gluten-free diet so as not to potentially increase the risk, doubling the risk of the child having a mental illness, which certainly no parent would want to have any influence in creating, absolutely. So it's interesting, there's one more point I want to make, which is that women's immune systems, when they're pregnant, take a few notches down. The reason that happens is because your immune system is supposed to attack foreign invaders, supposed to attack cancer cells and bacteria and viruses. So when you're pregnant, the baby's kind of a foreign invader. So this natural mechanism happens that when a woman's pregnant, that her immune system, what's called down-regulation, but it kind of goes down a few notches so as to not expel the child, okay? So it's a natural thing that happens, but a side effect of that is that women who are sensitive to certain things in their diet can cheat and feel okay often. And so for these women, in our practice, we always warn them, just because you can't feel it doesn't mean it's not creating a problem. And this study definitely corroborated that. So I hope this was helpful. Please share it with the young women and young men in your lives who are planning on having children. Certainly a very, very important piece of information for them to have. And please contact me if you have any questions or if you want to improve your health. Our destination clinic sees people from all over the world, and we're delighted to help. And until next time, I wish you very good health.